Hi everybody, it's Dr. Roth. Okay, let's start talking about some of the points from this week. So this week we're going to be talking about Chapter 6, Assessment and Intervention in the Prelinguistic Period, which includes infancy through the emergence of first words. So the chapter will emphasize that communication begins long before spoken language and that early social interaction forms the foundation of later language development. So I know you guys all just talked about that in your Jeannie article, how she had kind of missed that early language development period, and that was suspected to be one of the many reasons why she never fully forms language later on. But also we have also talked about in other things that there's a lot of communication going on in the infancy period, even if it's not words. All those gestures, eye contact, sound, gurgling, bubbles, they're all communication attempts. Nonsensical back and forth interactions. That's the beginning of back and forth conversational exchange. So there is a lot going on. So in the prelinguistic communication skills, we are going to look for eye contact, joint attention, gestures, turn taking, vocal play, like the babbling and the gurgling, right? And intentional communication. That back and forth exchange, words or not, is intentional. Or pointing, for example, they are intentionally showing you something or requesting something, potentially. The importance of caregiver-child interaction is huge in this stage. It influences language learning, including responsive communication styles and environmental supports. So again, anytime there's like a language disorder, we never want to say it's because of a parent or because of an environment. But we do know that for more quality language exposure, vocabulary exposure, interaction with a human, with spoken words, that helps to develop those that vocabulary, the language skills, which just can't be replaced by things like TV or apps or something like that. And then we're going to look for identification of early risk factors for language disorders. So this could include developmental disabilities, hearing loss, autism spectrum disorder, prematurity, and limited social engagement. So limited social engagement can mean many things, not just autism. So we just want to look at that by itself as, why could that be happening? So assessment methods used during this time period for the infants and toddlers might include parent interviews, observation in natural context, developmental checklists, play-based assessment, and analysis of communicative intent. So we're using our SLP eyes to look at all of those minute little movements and eye contacts and gestures, and we're gonna see, was that an intent to initiate, to respond, to request? Are they showing? Showing is a good sign of social intent, so that's a really good thing to observe. And a lot of times we're gonna try to elicit a reaction. So if you leave the baby, they might just be in their own little baby world, but if you, do something like, and then see if they grab and reach for it, so that's a kind of play-based assessment where we might kind of do the peekaboo or a lot of other, approaches, but really we want to see, okay, cool. So now we understand how they're socially interacting or speaking when left alone, but what if we tempt them a little bit? Or what if we attempt to engage? Will we elicit a sound? Will we elicit a laugh, pointing, grabbing, gesture? So in early intervention approaches, these tend to be family-centered, routine-based, and focused on increasing functional communication opportunities during daily activities. So for example, in early intervention, a lot of times, you are an assessment, you're observing the child, you are maybe doing those communication attempts or temptations, but you're also interviewing mom. And then when you start, or dad, and when you start doing therapy, a lot of it is going to be modeling how to do therapy with the child, but also teaching mom or dad how to do the therapy when you're not there. Because the hope is that exposure and therapeutic process continues while you're not there. And then you're also checking in, kind of touching in on pain points and giving them strategies for maybe some things that they want to try to target. Strategies SLPs use to encourage communication development include things like modeling. Like if I was telling mom, okay, you need to see if he'll request. So offer them the glass, and then pull it away. And then see if they'll be able to take it, or something. I'm just making that up. But the fact that I was modeling that for mom, I would then demonstrate it with the baby, see if baby could do it, and then have mom try it, right? Because we want to see if mom can do that. We want to model and see if she can do it so that she's more likely to do it when we're not there. We also might show how to expand child vocalizations. So take what they have and maybe build upon it. Maybe if they're trying to say more and they go ma 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 ma, maybe we're going ma ma more, and giving them something else, right? Creating communication temptations, we were talking about that, and supporting joint attention. Joint attention is big because that is how they're going to engage with the social world, and the social world can teach them what they need to know. So that's when you have the shared point of reference from both baby and mom, for example. And a lot of times that is maybe not present in our little ones with autism, something that we need to work on. So overall, the chapter highlights that interventions in the first year of life should prioritize social communication, caregiver coaching, and prevention of later language difficulties through early identification and support. Early intervention is the best intervention. When in doubt, screen. Always, always, always. We do not believe in the waited out approach. Okay, so just a few things to review. For birth to 3 years, speech and language milestones, so birth to 6 months. For receptive language, some things you might see as a startle to a sound, or recognizing a caregiver's voice, or turning to a sound. Expressive language can be cries differently for different needs, learning the child's cry, coos, making pleasure sounds, beginning vocal play and laughter, social communication such as eye contact, social smiles, engaging in turn taking. 6 to 12 months, it's going to look a little different. Receptive language might now be responding to the child is responding to their own name. They understand simple words like no or bye-bye. They follow simple routines. That's why we like to do all those like singing and gestures, because that's a routine, right? Can they engage in that, or at least be interested in that? Expressive language, babbling emerges, like ba ba ba, da da da. Uses gestures such as pointing or waving. Produces first true word around 12 months. One phrase I really like, it's kind of just a handy dandy one, is 1 word by 1, 2 words by 2. And what we mean is 2 word combinations by 2. So that's just a really easy back pocket thing to remember when you walk into any setting with like a birth to 3 child. How do they fall on that scale? Should we be concerned? Social communication, we want to be seeing that joint attention in this stage, the 6 to 12 month stage, and we want to use we don't want to see them using communication intentionally to gain attention or request objects. 12 months for receptive language, we want to see that they're understanding simple commands, identifying familiar people and objects. For expressive language, we want vocabulary to grow to about 10 to 50 words, using mostly nouns. And begins combining gestures with words. So that's good. And then that's when we can start doing the baby sign language. Probably we can always foster language development, but that's a good thing to do there. Pragmatics, are they initiating interactions? Are they using words to protest or request and not just sounds or gestures? 18 to 24 months. Receptive language is following one-step directions, understanding action words and body parts. Expressive language might be vocabulary explosion occurs. They might say things like more juice, mommy, go. And speech is now approximately 50% intelligible. Now we're looking at cognitive language skills as well, such as symbolic play and beginning to ask simple questions. And for the 24 to 36 months, we have understanding 2-step commands, understand basic concepts like big and little, using 3 to 4 word sentences now, using pronouns and grammar markers. Vocabulary is rapidly expanding. Speech is about 75% intelligible. Now they're beginning to participate in conversations, taking conversational turns, and using language for many functions, requesting, commenting, and questioning. It's a lot of information, a little overview. Make sure you read your chapter to learn more. Thanks.